Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of care of immune-suppressed patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all hospital services provided to immune-suppressed patients, medical, nursing, and allied staff. The purpose of this policy is 1. To prevent the acquisition of hospital-acquired infections among immunocompromised patients and minimize risk of healthcare-associated infections. 2. To reduce the chance of exposure and thus prevent the transmission of infection to the immunocompromised patients. 3. To give a protective environment for the patient by strictly following the standards, precautions, and other infection control practices by all personnel and visitors and healthcare workers. Definitions. 1. Immunocompromised patient or immunosuppressed patient is an individual who has one or more defects in the body's normal defense mechanism that predispose the person to infections, often life-threatening, which would not otherwise occur. It includes all patients with immunodeficiency, either congenital or acquired. 2. Neutropenia is characterized by a blood neutrophil concentration that falls below the average range of 1,000 cells per cubic millimeter. The term neutropenia is often used synonymously with granulocytopenia. 3. Severe neutropenia, severely immunocompromised patients, is characterized by a blood neutrophil condition that falls below 500 cells per cubic millimeter. Policy statement. 1. It is the policy of our hospital to provide appropriate care to immunocompromised patients, to provide guidelines on practices to minimize exposure of an immunocompromised patient to infectious diseases. 2. Strict adherence to all preventive and control of infection guidelines, especially hand hygiene and contact precautions with all immunocompromised patients. 3. Proper use of medications, especially antibiotics, with all immune-suppressed patients according to the recent clinical guidelines. Procedure. Number 1. Follow infection control guidelines. Proper hand hygiene with antimicrobial agents and other routine infection control practices will be strictly followed by all staff and visitors. The number of invasive devices used and procedures undertaken will be limited as much as possible. Any device will be discontinued if no longer necessary for medical reasons. Activities that may break cutaneous barriers will be avoided. For example, abrasions from bed linen, careless tape removal, use of enemas, rectal medications, and rectal thermometers. Good oral hygiene will be maintained. This includes teaching the patient about appropriate atraumatic oral care using soft toothbrushes and normal saline rinses. Isolation of patients with total granulocyte count below 500 per millimeter because they are at risk of infection from their own microflora. Thus, efforts to reduce the risk of colonization of the gastrointestinal tract with antibiotic-resistant organisms are appropriate. Patients should be in a private room if possible in order to minimize contact between the patient and other individuals with potentially contagious infections. Protective isolation room is not required for such patients. Medical staff with potentially contagious diseases will not have contact with granulocytopenia patients. The granulocytopenic patient will wear a mask when leaving his or her room. No visitors with communicable disease will be allowed to enter patient's room. Strict hand washing will be practiced according to WHO 5 moments. Number 2, follow clinical guidelines. A. Findings that appear suspicious and may be suggestive of infection will be investigated. They are temperature more than 38 degrees centigrade in neutropenic and other immune-compromised patients. Erythema and pain in areas were previously asymptomatic. Pulmonary infiltration on chest X-ray film with or without evidence of rales or consolidation. Definite decrease in the patient's level of responsiveness or a sudden change in mental status. B. Patients who are on bed rest will be encouraged to turn, cough and take deep breaths every 2 hours. Number 3, maintain safe environment. Sinks and bathroom fixtures will be kept dry to prevent growth of bacteria. Sterile water shall be used for room humidifiers. Water and ice will be brought from sterile sources if possible. Number 4, provide appropriate diet. Diet will not contain salads, raw vegetables, or milk products. No food will be brought in from outside the hospital. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.